Okay, so here we have part 2 of chapter 9. We're going to talk about word ports, some terms built from word ports, some terms not built from word ports. Remember, you're going to have a heavy emphasis again this semester with having to break down the word root and the prefix and suffix. Remember how we had to draw a line. So in this case, omnionitis is going to be right here. Chorioamniotis. Remember, we have choreo, amnio, and then itis. And dystocia, remember, we can split this up according to our prefixes and suffixes and word roots. And you should be able to define all of these based on your knowledge of those terms from this chapter. Remember, you may have some from last chapter as well. So I wanted to talk to you a little bit more. Let's go back one slide. Okay, these are not built from word ports. Abortion, abruptio placentae, eclampsia, ectopic pregnancy, placenta previa, and preeclampsia. Abruptio placentae, that's when there's an issue with the placenta. If there is any problem with the placenta at all during pregnancy, it can be life-threatening for both the mother and the baby because it is such a large supplier of blood back and forth between the two. So it's very important that a lady seek immediate medical assistance if they have any of these issues. Ectopic pregnancy, remember we talked about how a fertilized egg can become implanted in the fallopian tube. That's an ectopic pregnancy. Okay, here are some of the disorders with the placenta. Notice here the placenta is up along the wall, but it's leaking down, so that's not a good thing. Here the placenta has pulled away from the uterine wall, and here it's completely away from the uterine wall. So it's showing you a progression of this disorder. Placenta previa, notice the placenta is coming out before the baby. It's usually always delivered after. An ectopic pregnancy, like we just talked about, remember it's developing in this fallopian tube, and there's just simply not enough room for a baby to develop here, and there's just no way to get this developing embryo down into the uterine lining. Okay, so now we're going to talk about a few neonatology terms. Microcephalus, remember cephalic means head, micro means small, so we're going to say pertaining to a small head. So remember, built from word ports, you will have to know some of your previous terms as well. This is a hernia, a baby born with a hernia. A couple other things not built from word ports, cleft lip and palate, and that's not very common, but there are several babies born often with a cleft lip and palate, and a picture of that can be found in your textbook. Down syndrome, remember that's one extra chromosome. Erythroblastosis fetalis, that's a disease of red blood cells. Fetal alcohol syndrome, remember we talked about things can go back and forth across the placental membrane, and they can go back and forth from mother to baby, and that's when a mother drinks alcohol during pregnancy and the baby actually becomes addicted to alcohol. Spina bifida is actually an opening in the back of the spine of the baby. Nowadays they can do surgery while the baby's still in the womb. These are a few pictures of things that are not built from, some are built from word ports, some are not. These are obstetric, which means it occurs during the pregnancy phase. Amniotomy, amnio is the amniotic sac. Episiotomy is when they have to cut that the area to allow for birth to occur. So again, we have some more built from word ports. Here we have an ultrasound, and here's how they actually do an amniocentesis. They actually go into the amniotic sac and pull some of the amniotic fluid out, and they usually do that when they're trying to diagnose any sort of chromosome abnormality. And the last part of this are the complementary terms. Please know all of these, built from word ports, not built from word ports, and of course, as always, our abbreviations. I am going to include some more information